What's up, everybody? This is Dr. Courtney, board certified orthodontist at Smile Pop in New York City. I love trolling on Reddit. I don't troll, but I do like to, not educate, but empower people to understand a little bit more of what's going on, especially when it comes to Invisalign, because that's all I do. I've been doing it for almost 20 years at this point. But it's a rainy day in New York. I'm thinking, let's respond to a couple of these posts. So this is interesting. So this is someone, I'm 36 years old, debating on Invisalign or traditional braces. Look, both are tools that apply force onto teeth. So it's which tool does your doctor that you trust use best? For me, it's Invisalign. But my orthodontist said I'm a candidate, but my right lateral incisor might be hard to move with Invisalign. And so the tooth that's in question is this guy, because it is further back. The two teeth that are the most annoying teeth to move, I think, are those lateral incisors. That's why we typically put attachments on them. Without attachments, it's almost like gripping a wet watermelon seed. So we use other tools in our toolbox to help bring something like that forward. And so I'm going to show you an example. But it says it might be hard to move with Invisalign due to bone in the area or something. It's like a lot of stuff, but yes. She said we can reassess mid-treatment, or if Invisalign isn't moving that tooth, we'd likely put partial traditional braces on. Yeah, there's so many different ways to skin a cat here, but I'm going to show you how I do it because I see these quite a bit. So here's some examples. So this is my assistant's brother, or actually this is a variety of patients, but here, similar case, the lateral incisor is what we call in crossbite relative to the bottom. So it's tucked behind, and it's going to be hard to push that tooth forward because Invisalign clear aligners work by pushing teeth in position. So let's throw like a push with clear aligner, but let's also add a pull effect on it. And so what I mean there is let's put a button behind that tooth there. So I'm going to show you an example. So this is where the tooth was when it started. This is how it is now. But what we do is I actually glue a button behind these teeth so you can't even see it from the top. So it's not like in your face obnoxious. And then we put a little button on the bottom front tooth. So in this case, this was probably a male, and so we put metal, and then this is a female. Not really, I'm just kidding, but we put something more tooth colored. Same thing here, we put something tooth colored. But basically you would wear a rubber band from behind that lateral incisor tooth and run it down to the tooth on the opposing arch, and that rubber band is going to help pull that tooth in position, and you're going to use the tooth on the opposing arch to help pull it into position. So there is a pretty straightforward strategic way to move that attachment forward. So for me, I don't have any trouble with it, and I don't think Invisalign alone, yeah, there's trouble. Invisalign with rubber bands, much easier. So Invisalign's not totally out of the question, but I would consider adding a button. One thing I will mention is when a tooth starts off back like that, the gum tissue doesn't really know where to go once you pull that tooth forward. And so we haven't done it yet in this patient, but one of the things that I like to do is once that tooth is forward, we do like to laser off and contour that tissue. Just like your pants have pockets, your gum tissues have pockets. And when that tooth was far back, that gum tissue didn't know where to go. And so by taking off some of that extra gum tissue, you actually show the full height of the tooth so that it matches the other side, and you get rid of a big bacteria trap. So going back to this original Reddit post, you can totally move that tooth forward. This looks like a very tough, complicated case, but totally doable. But I would recommend Invisalign clear aligners with buttons so that you can wear rubber bands. And again, the buttons don't have to be on the front of your tooth. And for this particular force vector, you actually want the button behind it. So thank you so much. Hopefully that answered your question, and it shuts this train of thought down. I'm just kidding. I love reading them. But if you have any questions, feel free to comment, but this is straightforward with Invisalign as long as you use the extra auxiliary tools that we have in our caps. So thank you so much. Bye.